Coming up, what to expect in your state as Australia eases out of lockdown. Plus, forever changed, the massive challenges on our transport networks in a post-COVID society. You're watching The Virus. Hello, I'm Jeremy Fernandez. The prospect of a COVID-free economy by July is now firmly in the hands of state and territory leaders after National Cabinet agreed to a three-stage plan. Broadly speaking, Stage 1 limits gatherings in one place to 10 people and 5 people at home. Stage 2 lifts the numbers in most settings to 20 people. And then in July, the federal government hopes we'll be at Stage 3, which will allow groups up to 100. These plans are being laid out because of the case rate, which is manageable despite a few clusters. As long as the daily infection rate remains below 20, with occasional outbreaks factored in, hospitals will be well equipped to deal with it.
We can handle a certain level of infection in the community, and we'd hope to keep it down to just, say, spot fires, really, that could easily be explored and quenched. But we don't want to get back to a situation, or the type of situation, of course, they've had in Europe, and that would mean another shutdown. So that's to be avoided at all costs.
And here's how this will roll out. Each state and territory will move at its own pace. The main focus, of course, being on those most affected by the outbreak. As we've heard, advancing to stages 2 and 3 depends on how the case rate fluctuates and how the outbreaks are managed. The premiers of New South Wales and Victoria had already foreshadowed they would be cautious with making any changes. Victorians will find out exactly what that entails over the coming days. Anxiety there is on show already, with protesters breaking distancing and gathering rules to voice their frustrations. Well, the Victorian plan is expected to be quite similar to those rolling out in Queensland and New South Wales later in the week. Both Queensland and New South Wales will open up parks, playgrounds and pools, with gatherings of 10 people allowed in outdoor areas. Cafes and restaurants will also be able to have up to 10 people dining in. Weddings will be allowed to have up to 10 guests, and funerals can go ahead with up to 20 mourners indoors or 30 outdoors. But where Queensland and New South Wales differ is travel. Queenslanders can go on 150-kilometre day trips, but there's no opening up of widespread movement yet in New South Wales. South Australia is also moving this week, and Tasmanians will have to wait until the 18th of May for the full suite of Stage 1 provisions. But when they do come into force, both states will allow 10 people at restaurants, cafes, pools and boot camps. Regional travel and tourism is high on the agenda for both states. National parks and reserves will be opened, and South Australia's government is making a point of allowing caravan and camping holidays. Now, some jurisdictions are already moving into Stage 2 of the national plan. From Friday, the Northern Territory will allow dining at restaurants and exercises at gym for less than 2 hours. Phase 2 rolls out in WA from the 18th of May, with limits of 20 people at indoor and outdoor gatherings. Regional travel restrictions are being eased, but the big unknown in the top end is border closures. The NT Chief Minister Michael Gunner says they're likely to continue for some time.
SA can't guarantee for me their border Victoria. Queensland can't guarantee for me their border in New South Wales. So that, for me, just strikes it straight out. WA, I think, is doing a great job, but we obviously had the outbreak in the Kimberley. So for me, all 3 borders at the same time and last.
And that uncertainty around travel is weighing heavily on the nation's medical and political leaders. Traditionally, Australia's vast landmass relies on regional and interstate travel corridors to keep every town and city's economy ticking over. And that's not even factoring in indefinite separation between family and friends. The Dean of Health Sciences at the University of Melbourne, Professor Kshitij Kapoor, has led a report by the group of 8 universities. Now, he says interstate border controls remain one of the big unknowns.
In the unfortunate situation that one of the adjoining states has a big second surge, we will have a dilemma, because then what you'd have to do by theory is restrict travel between those jurisdictions. And that could get politically tricky, it would be economically tricky, and it would be a tough call to make. The good outcome would be that many of our states can eliminate it, and the others come so close to elimination that you can come up with some sensible travel guidelines.
One of the architects of the medical guidelines and the plan is the Deputy Chief Medical Officer, Dr. Nick Coatsworth. He says passenger loads on commuter services such as buses and trains will change dramatically. I put some of your questions to him earlier. So what does mobility mean in the context of public transport? We have a question here about how public transport, the flow of human traffic, will be controlled once these restrictions are eased.
So this is one of the things that absolutely has to form part of the change in behaviour and how we structure our lives. Staggering work times is going to be critically important. Maintaining physical distance in the ways that are practical on public transport is going to have to be an important element of how states and territories implement these stepwise lifting of restrictions. So it's not going to be the same as it was before COVID. Obviously, people crammed into buses and trains, but that means that there are going to be challenges and difficulties that have to be overcome.
Dr. Coatsworth, I'll get you to weigh in on this notion of a South Pacific and Trans-Tasman bubble, and also the borders being reopened between states and territories domestically.
Well, I think on the first one, Jeremy, it's eminently possible. It will take longer to see how we move through steps 1 to 3, and then we can certainly give consideration to the Trans-Tasman and Western Pacific bubble on the back of a really strong history of health assistance in the Western Pacific, remembering that we sent Australian medical assistance teams to Cyclone Winston in Fiji and Pam in Vanuatu, and more recently assisted Samoa with the measles outbreak. So we've got a very strong history of assistance there in the in the Western Pacific. The idea that state and territory borders will open, of course, is the same sort of argument and requires time to see what happens through stages 1 to 3, and also is a decision that individual jurisdictions will take their time to make on their own, according to the principles that the Prime Minister has outlined. The number one being that it wouldn't present an undue risk to their citizens to open the borders. So I think the argument applies just as much to state and territories. Obviously, it would make sense for those borders to open first before we sought to open international borders, and we'll be moving through those options in the coming weeks.
First a city, then a country, then the world. With reports of deaths on most continents and no vaccine in sight, the questions remain. How far will the virus spread? How many lives will it take?
So let's take a look at the bigger picture. Globally, more than 4 million cases of COVID-19 have now been confirmed. Of those, about 1.4 million have fully recovered. The total number of deaths linked to the virus now exceeds 280,000. The severe outbreaks in the United States, Spain and the UK are still a major concern. And there's also growing alarm for countries such as Russia and Brazil. Hospitals there are reaching breakpoint, with thousands of new cases being registered daily. The figures from overseas are a blunt reminder of why governments here are so cautious about lifting restrictions. Italy is now allowing movement and family gatherings, even though it's still registering around 1,000 new cases a day. It's also passed 30,000 deaths, and health officials there are worried the government has acted too soon. Even bars have reopened, and restaurants and tourist attractions may also open their doors soon. Meanwhile, the UK has also passed 30,000 deaths, giving it the world's second highest death toll after the US. Even so, the government is outlining measures to ease its lockdown on the belief that Britain has now passed the peak of the crisis. And that's likely to include a 14-day quarantine period for anyone entering the country, and there'll be a public alert system similar to the ones used for terror threats. Well, that's it for now. Thanks for joining us. There's more on that Q&A session with Deputy Chief Medical Officer Dr. Nick Coatsworth, as well as our political editor Andrew Probyn on the ABC News YouTube and Facebook channels. For now, stay safe. Goodbye.